Okay, the GLP-1 drugs are everywhere right now for weight loss. You got the Ozempic, the Wegovy, Mounjaro, Zepbound, and again, everyone's talking about them right now, super popular. But there is a thyroid cancer warning on the label. So let's talk about that. What's that all about? Do you need to be worried? So what are the GLP-1s? So GLP stands for glucagon-like peptide, and these drugs mimic a natural hormone that's in our gut that does four things. First, it tells your pancreas to release more insulin when high blood sugar is noted. Second is it suppresses glucagon, which is that hormone that raises your blood sugar. Third thing is it does slow your gastric emptying. And then the fourth thing is it does decrease your appetite because it suppresses the hunger centers that are in your brain. Now, these were originally studied, of course, for diabetes management, but during the studies, researchers found that, hey, people were losing weight with them. With semaglutide, they found even up to like 15, 16%, which prompted everyone's interest in weight loss, and it's off and going, as everybody knows now. So the FDA did approve Wegovy for chronic weight management in 2021. The others, most of them are still for diabetes, but they're being used off-label for weight management and are working pretty well. Okay, so back to the thyroid cancer warning. What is up with that? So your thyroid has C cells within it, and the GLP-1 receptors are found on those C cells. So when researchers gave just high doses of the GLP-1 drugs to rodents, they found that those C cells grew and some became tumors. But here's the key. So they gave massive doses, much higher than what humans would get to the rodents, which probably is the reason it stimulated them more. And rodents have much higher numbers of those GLP-1 receptors on the C cells than humans do. So does it relate to humans? Jury's still out a little bit. So what type of cancer is it? It's called medullary thyroid carcinoma. It's a neuroendocrine tumor, we call it, again, of those C cells. Pretty rare form of thyroid cancer. It's about 1 to 5% in humans. But it does tend to be more aggressive. It tends to metastasize to lymph nodes more quickly than the other thyroid cancers we typically see. So what does the human data show? Honestly, not much at this point. It's kind of mixed. Some studies do suggest maybe a slightly higher increase of thyroid cancers with people that are taking them, but other studies are not showing that at all. So jury is still out on that. It's still being studied. So who is at risk? Anyone who has a family history of medullary thyroid carcinoma or what's called an MEN syndrome. Shouldn't take the GLP-1s. Black box warning, just don't do it. Okay, so there it is. If you're thinking about GLP-1 drug for yourself or family member, ask your family, anybody with thyroid cancer history or any of those MEN syndromes. And then, of course, talk with your doctor. They'll go over risks with you as well and see if it's right for you. Now you knows, follow for more.